Hi there, welcome to Study Race. Today we are going to study about psychosis, its causes, symptoms, and treatment. Psychosis is a mental health condition that affects the way a person thinks, feels, and perceives reality. People with psychosis may experience hallucinations, delusions, and disorganized thinking. Hallucinations are sensory experiences that are not real, such as hearing voices or seeing things that are not there. Delusions are false beliefs that are held with conviction, even in the face of evidence to the contrary. Disorganized thinking is characterized by incoherent speech or thought patterns. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the standard diagnostic manual used by mental health professionals in the United States, defines psychosis as a syndrome characterized by hallucinations, delusions, disorganized thinking, and negative symptoms. Negative symptoms are a group of symptoms that are characterized by a loss of normal functions, such as motivation, interest, and emotion. If we talk about the prevalence rates, the prevalence of psychosis varies depending on the population studied. In general, it is estimated that about 1% of the population will experience psychosis at some point in their lives. However, the prevalence of psychosis is higher in some groups, such as people who have a family history of mental illness, people who have experienced trauma, and people who use certain drugs, such as amphetamines and cocaine. People with psychosis often face significant stigma. This stigma can make it difficult for people with psychosis to get the help they need. People with psychosis may be afraid to seek help because they are afraid of being judged or discriminated against. They may also be afraid of being hospitalized. Myths and misconceptions. There are many myths and misconceptions about psychosis. Some of these myths include: people with psychosis are dangerous. People with psychosis are violent. People with psychosis are unpredictable. People with psychosis are not capable of living a normal life. These myths are not true. People with psychosis are no more dangerous than anyone else. In fact, people with psychosis are more likely to be victims of violence than perpetrators. People with psychosis are also capable of living a normal life. With treatment, people with psychosis can recover and go on to live productive and fulfilling lives. If you or someone you know is experiencing psychosis, it is important to seek help. There are many effective treatments available. With treatment, people with psychosis can recover and go on to live full and meaningful lives. Psychosis is a mental health condition that affects the way a person thinks, feels, and perceives reality. People with psychosis may experience hallucinations, delusions, and disorganized thinking. If we talk about positive symptoms, positive symptoms are symptoms that are not present in healthy people. They include hallucinations, delusions, disorganized thinking. Hallucinations are sensory experiences that are not real, such as hearing voices or seeing things that are not there. People with hallucinations may hear voices that are talking to them, see things that are not there, or smell things that are not there. Delusions are false beliefs that are held with conviction, even in the face of evidence to the contrary. People with delusions may believe that they are being followed, that they have special powers, or that they are being persecuted. Disorganized thinking is characterized by incoherent speech or thought patterns. People with disorganized thinking may have difficulty following a conversation, may jump from topic to topic, or may make up words or phrases. Negative symptoms are symptoms that are a loss of normal functions. They include alogia, avolition, flat affect, anhedonia. Alogia is a loss of speech. People with alogia may speak very little or may use very simple language. Avolition is a loss of motivation. People with avolition may have difficulty starting or completing tasks. They may also have difficulty making decisions or taking initiative. Flat affect is a loss of emotional expression. People with flat affect may not show any emotion, even when they are experiencing strong emotions. Anhedonia is a loss of the ability to experience pleasure. People with anhedonia may find it difficult to enjoy activities that they used to enjoy. They may also find it difficult to feel happy or excited. Cognitive symptoms are symptoms that affect a person's ability to think, remember, and learn. They include attention problems, memory problems, problem-solving difficulties, decision-making difficulties, learning difficulties. Some common symptoms of psychosis include hearing voices, seeing things that are not there, believing things that are not true, difficulty thinking clearly, difficulty concentrating, difficulty making decisions, difficulty controlling emotions, social withdrawal, loss of interest in activities, changes in sleep patterns, changes in appetite, changes in energy levels. If you or someone you know is experiencing any of these symptoms, it is important to seek help from a mental health professional. If we look at causes, psychosis is a complex condition with no single cause. It is thought to be caused by a combination of genetic, environmental, and psychological factors. Genetics play a role in the development of psychosis. People who have a family history of psychosis are more likely to develop the condition themselves. Environmental factors that may contribute to the development of psychosis include trauma, stress, drug use, abuse, poverty, lack of social support, and trauma and stress. People who have experienced trauma or stress are more likely to develop psychosis. This is because trauma and stress can damage the brain and make it more susceptible to psychosis. Drug-induced psychosis. Psychosis can be caused by certain drugs, such as amphetamines, cocaine, LSD, marijuana, and PCP. Drug-induced psychosis is usually temporary and goes away when the person stops using the drug. However, in some cases, drug-induced psychosis can lead to a more permanent form of psychosis. Risk factors. Psychosis is a mental health condition that affects the way a person thinks, feels, and perceives reality. People with psychosis may experience hallucinations, delusions, and disorganized thinking. If we talk about risk factors, there are a number of risk factors for psychosis, including age. Psychosis is more common in young adults than in older adults. The average age of onset for psychosis is 25 years old. Gender. Men are more likely to develop psychosis than women. The male-to-female ratio for psychosis is about 1.5 to 1. Family history. People who have a family history of psychosis are more likely to develop the condition themselves. The risk of developing psychosis is about 4 times higher if a person has a parent or sibling with psychosis. Substance abuse. People who abuse drugs, such as amphetamines, cocaine, and LSD, are more likely to develop psychosis. Social isolation. People who are socially isolated are more likely to develop psychosis. This is because social isolation can lead to stress and loneliness, which can trigger psychosis. Trauma. People who have experienced trauma, such as abuse or neglect, are more likely to develop psychosis. This is because trauma can damage the brain and make it more susceptible to psychosis. Brain injury. People who have suffered a brain injury are more likely to develop psychosis. This is because brain injuries can damage the brain and make it more susceptible to psychosis. Mental illness. People who have other mental illnesses, such as depression or anxiety, are more likely to develop psychosis. This is because other mental illnesses can increase the risk of developing psychosis. It is important to note that not everyone who has one or more of these risk factors will develop psychosis. Psychosis is a complex condition with multiple causes, and it is not always possible to predict who will develop the condition. Now, let's move to diagnosis of psychosis. Psychosis is a mental health condition that affects the way a person thinks, feels, and perceives reality. People with psychosis may experience hallucinations, delusions, and disorganized thinking. Diagnosis of psychosis is made by a mental health professional, such as a psychiatrist or psychologist. The diagnosis is based on a thorough assessment of the person's symptoms, medical history, and social and family history. There is no single test that can diagnose psychosis. The diagnosis is made based on the person's symptoms and the results of the assessment. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the standard diagnostic manual used by mental health professionals in the United States, defines psychosis as a syndrome characterized by hallucinations, delusions, disorganized thinking, negative symptoms, alogia, avolition, flat affect, and hedonia. Early intervention is important for people with psychosis. Early intervention can help to improve the person's chances of recovery and prevent the condition from worsening. Diagnostic tools and assessments. There are a number of diagnostic tools and assessments that can be used to diagnose psychosis. These tools and assessments can help to identify the person's symptoms and to rule out other possible conditions. Some of the most common diagnostic tools and assessments for psychosis include mental status examination, structured interviews, rating scales, neuropsychological testing, cautions and challenges in diagnosis. There are a number of cautions and challenges in the diagnosis of psychosis. These include: the symptoms of psychosis can be similar to the symptoms of other conditions, such as schizophrenia, bipolar disorder, and major depressive disorder. The symptoms of psychosis can be caused by medical conditions, such as drug abuse, brain injury, and infection. People with psychosis may not be able to recognize that they are ill or may not want to seek help. It is important to work with a qualified mental health professional to get a diagnosis of psychosis. A qualified mental health professional will be able to rule out other possible conditions and to develop a treatment plan that is right for the individual. There are various ways for management and treatment of this disease. There are a number of different types of treatment available for psychosis. The most common types of treatment include medications, psychotherapy, hospitalization, community-based treatment, and complementary and alternative therapies. Medications. Medications are the most common type of treatment for psychosis. Medications work by blocking the effects of dopamine, a neurotransmitter that is thought to play a role in the development of psychosis. There are a number of different types of medications available for psychosis. The most common types of medications include antipsychotics, mood stabilizers, and antidepressants. Psychotherapy. Psychotherapy is a type of talk therapy that can help people with psychosis to understand their condition and learn how to cope with the symptoms. Psychotherapy can also help people with psychosis to develop coping skills and to improve their quality of life. Hospitalization. Hospitalization may be necessary for people with psychosis who are a danger to themselves or others. Hospitalization can provide people with psychosis with the care they need to stabilize their symptoms and to develop a treatment plan. Community-based treatment. Community-based treatment is a type of treatment that is provided in the community, rather than in a hospital. Community-based treatment can include outpatient therapy, day treatment, and supported housing. Outpatient therapy is a type of therapy that is provided on an outpatient basis. Outpatient therapy can include individual therapy, group therapy, and family therapy. Day treatment. Day treatment is a type of treatment that is provided during the day. Day treatment can include individual therapy, group therapy, and activities that can help people with psychosis to improve their skills and to develop their independence. Supported housing. Supported housing is a type of housing that provides people with psychosis with the support they need to live independently. Supported housing can include on-site staff, group activities, and transportation, complementary and alternative therapies. Complementary and alternative therapies, CAM, are treatments that are not considered to be standard medical treatments. CAM can be used in addition to or instead of traditional medical treatments. There are a number of different types of CAM available for psychosis. Some of the most common types of CAM include acupuncture, herbal medicine, yoga, meditation. CAM is not a cure for psychosis, but it can help people with psychosis to manage their symptoms and to improve their quality of life. It is important to talk to your doctor before trying any CAM treatments. Psychosis is a complex condition with no single cause. There is no cure for psychosis, but there are treatments that can help to manage the symptoms and improve quality of life. Treatment for psychosis usually involves a combination of medication and therapy. Medications. Medications are the most common type of treatment for psychosis. Medications work by blocking the effects of dopamine, a neurotransmitter that is thought to play a role in the development of psychosis. There are a number of different types of medications available for psychosis. The most common types of medications include antipsychotics, mood stabilizers, and antidepressants. Antipsychotics are the most common type of medication used to treat psychosis. Antipsychotics work by blocking the effects of dopamine, a neurotransmitter that is thought to play a role in the development of psychosis. Mood stabilizers. Mood stabilizers are used to treat the mood symptoms of psychosis, such as depression and mania. Mood stabilizers work by balancing the levels of certain neurotransmitters in the brain. Antidepressants. Antidepressants are used to treat the depressive symptoms of psychosis. Antidepressants work by increasing the levels of certain neurotransmitters in the brain. These medications can have side effects, such as weight gain, restlessness, and sedation. It is important to talk to your doctor about the risks and benefits of antipsychotics before starting treatment. Psychotherapy is a type of treatment that can help people with a variety of mental health conditions, including psychosis. Psychotherapy can help people to understand their condition, learn how to cope with their symptoms, and improve their quality of life. There are many different types of psychotherapy, and the type that is best for an individual will depend on their specific needs and preferences. Some of the most common types of psychotherapy for psychosis include cognitive behavioral therapy, CBT. CBT helps people to identify and change the negative thoughts and behaviors that contribute to their psychosis. Family therapy. Family therapy can help families to understand psychosis and to develop coping strategies. Individual therapy. Individual therapy can help people to explore their thoughts, feelings, and experiences in a safe and supportive environment. Psychotherapy can be an effective treatment for psychosis, but it is important to find a therapist who is experienced in treating this condition. Psychotherapy can also be expensive, and it may not be covered by insurance. Benefits of psychotherapy: can help people to understand their condition. Can improve quality of life. Psychotherapy can improve people's quality of life by helping them to manage their symptoms, improve their relationships, and return to work or school. Limitations of psychotherapy: can be expensive. Psychotherapy can be expensive, and it may not be covered by insurance. May not be effective for everyone. Psychotherapy is not effective for everyone, and it may take some time to find a therapist who is a good fit. Can be time-consuming. Psychotherapy can be time-consuming, and it may require regular appointments. If you are considering psychotherapy, it is important to talk to your doctor or a mental health professional. They can help you to determine if psychotherapy is right for you and can refer you to a qualified therapist. Recovery and coping. Recovery from psychosis is a process that can take time and effort. There is no one-size-fits-all approach to recovery, and what works for one person may not work for another. However, there are some general principles that can help people to recover from psychosis. Goals of recovery. The goals of recovery from psychosis are to reduce symptoms. The first goal of recovery is to reduce symptoms of psychosis, such as hallucinations and delusions. This can be done with medication, therapy, and lifestyle changes. Improve quality of life. The second goal of recovery is to improve quality of life. This can be done by returning to work or school, building relationships, and participating in activities that are meaningful. Prevent relapse. The third goal of recovery is to prevent relapse. This can be done by staying on medication, attending therapy, and managing stress. Support and self-help. Recovery from psychosis can be a challenging process, but there are many resources available to help people. Support from family and friends, as well as self-help strategies, can make a big difference in the recovery process. Family and caregiver roles. Family and caregivers play an important role in the recovery process. They can provide support, encouragement, and practical help. They can also advocate for the person with psychosis and help them to access the resources they need. Coping strategies and resources. There are many coping strategies that can help people with psychosis to manage their symptoms and improve their quality of life. Some common coping strategies include getting enough sleep. Getting enough sleep is important for everyone, but it is especially important for people with psychosis. Sleep deprivation can make symptoms worse. Eating a healthy diet. Eating a healthy diet can help to improve mood and energy levels. It can also help to reduce stress. Exercise. Exercise is a great way to reduce stress and improve mood. It can also help to improve sleep. Relaxation techniques. Relaxation techniques, such as meditation and yoga, can help to reduce stress and anxiety. Social support. Social support is important for everyone, but it is especially important for people with psychosis. Spending time with friends and family can help to reduce isolation and loneliness. There are also many resources available to help people with psychosis. Some common resources include mental health professionals. Mental health professionals, such as psychiatrists and psychologists, can provide medication, therapy, and support. Support groups. Support groups can provide a safe and supportive environment for people with psychosis to share experiences and learn from each other. Online resources. There are many online resources available to provide information and support to people with psychosis. Recovery from psychosis is a journey, not a destination. There will be ups and downs along the way, but with support and self-help, it is possible to recover and live a full and meaningful life. At last, thank you everyone.